So let's go over my resume that I would submit on a daily basis to break into the pharmaceutical industry. So I've had a lot more than just 3 jobs over my years, but these were kind of the 3 main jobs that really helped me break into the pharmaceutical industry. And there's a lot of transferable skills within these 3, so I wanted to cover them. Starting with the most recent is Walgreens Pharmacy. I was a certified pharmacy technician for over 3 years, and I worked between 3 different locations. So I had retail pharmacy on my resume, I have specialty compounding within the hospital, and I also have the data processing center. Over the 3 years that I spent there, all the locations that I worked at, there was a lot that came with the job. The best and number one most crucial skill that I learned was prior authorizations. That transferred over so well when I was looking at jobs within the pharmaceutical industry. When I told, some of the recruiters, the hiring managers that I had that knowledge and the experience, it was kind of a light bulb went off, and it's like, okay, we need to interview her. Along with prior authorization knowledge, managed care, Medicare, Medicaid is also very crucial. You're going to deal a lot with that when you come into the pharmaceutical industry. And so if you have the knowledge, that's great. Here are some of the key points that I kind of put on my resume. A lot of medical terminology, which is awesome. Just having, basic information of medication, drug interactions, understanding drug use, just kind of knowing how to speak to physicians because you will spend a lot of time on the phone with them, insurance companies and the patient, customer service. There's a lot of skills that go into being a pharmacy tech, and it helped me get a job in the pharmaceutical industry. Working our way down, we have Nordstrom. I was a sales associate there for a little over a year. There's a lot of selling that obviously goes into Nordstrom, a lot of face-to-face selling. There's going to be a lot of metrics that you're going to hit. And when applying for sales roles, that is exactly what they're going to ask you. Can you share your metrics and your quotas that you've hit? And obviously, I hit those at Nordstrom, and I was able to provide those numbers for them. Last but not least is my internship at Hale 911. I did this through my university. I had to get an internship from my senior year, and so that is where I completed it. I was an inside sales account manager. Essentially what it was is a call center, and we were doing a lot of cold calling, a lot of lead generation, a lot of building relationships and networking. And obviously that is super important when breaking into the pharmaceutical industry because once again, you're showing them that you know how to conduct sales, you know how to build those relationships and build that business. And that's exactly what I did at this company. A lot of B2B properties, a lot of B2B businesses, you had to do a lot of cold calling a day, sometimes 50 to 60 cold calls a day. And that's kind of what they're looking for to see if you can close on deals. And this is exactly what I showed. So basically these 3 are the ones that I really highlighted in all of my interviews prior to breaking into the industry. Obviously now, if I were to look for a new job, I would not really use these. I would use my current experience. But hopefully this answered your question and you guys can kind of use these as a rough draft. If you have any questions, you can leave them down below.